Hi, it's Dr. Garza. Today for my Tuesday talk, I want to talk about a medical condition that I often screen for and treat within my adolescent medicine practice. I'm referring to thyroid conditions. So many teens don't know what their thyroid is, and some might have heard their parents with history of thyroid issues, but it is a very important medical condition to screen for because when there is thyroid dysfunction, that can really affect how patients feel and can cause many physical and mental health symptoms. So, we include testing for thyroid function on our lab evaluation of patients. We do that when we're doing screening labs at a well visit, which is a preventive visit. We also order testing when we are evaluating for mental health, when there's a new change in mood, energy, fatigue, concentration, even also anxiety and physical symptoms related to anxiety. It's really important to check the thyroid to make sure that that is not an underlying factor that's affecting how that patient feels in regards to their mental health. We also check it when we are concerned with other physical symptoms that patients may come in with. Fatigue being probably the most common one, low energy, weight changes that are unexplained, sleep issues, increased need for sleep, or even what we call somnolence, which is a lot of daytime sleepiness, and hair loss, skin changes, bowel changes, period changes. There's lots of different physical things that can present with due to underlying thyroid issues. So the thyroid gland is a small gland in your neck that's supposed to be shaped like a butterfly, kind of in this lower part of your neck, and it controls your metabolism, and it has, I always tell patients, it's a small gland with really big effects in your body and affects many different physical systems within the body. So again, when we're hearing about some of these physical symptoms, in the back of my mind, I'm thinking we should look at thyroid to make sure that that is not what's going on here and that's not the underlying cause of these symptoms. So when we check the thyroid, there are two ways the thyroid function can be abnormal. Of course, there's a normal range. And then there can be thyroid labs that indicate low thyroid function, which is called hypothyroidism. And there are labs that show high over functioning thyroid, which is called hyperthyroidism. About 90% of cases are due to low thyroid. Hypothyroidism is much more common. It tends to be more common in women, and it often has a strong family history. There are different causes of low thyroid function, the most common being what is considered an autoimmune condition. An autoimmune means where the patient's body has caused inflammation and that's affected the function of the thyroid. So it's called autoimmune thyroiditis, and its older name that patients might recognize is called Hashimoto's thyroiditis, and that's due, I imagine, to a Dr. Hashimoto who first described it. Many things in medicine have names like that of doctors that first describe conditions. So that is the most common form of low thyroid function. When we see a thyroid test be abnormal, I often will do screening tests for those antibodies that may indicate a patient has an autoimmune condition. And there are different levels, of course, of labs that meet criteria to be treated with medicine, and there's other levels where we just keep an eye and check that, monitoring that more frequently. So again, the thyroid, it's a complex condition in the sense that there's many things we look at as far as how it's affecting someone physically and emotionally. We look at lab work, but it's something that I feel very comfortable in managing in my office, especially the low thyroid function. That just kind of feeds into my general practice and comprehensive approach. Now, on the other end, just briefly, hyperthyroidism has a different evaluation and different a different kind of criteria. I typically refer those patients to endocrinology for management because often they need imaging, they may need different treatments, kind of beyond the scope of what we do here in adolescent medicine. So just thought I'd let you know about that and what it means to have your thyroid checked and how we approach treatment. Thank you.